What are some of the challenges or barriers that you're seeing in terms of what's causing this or preventing management of diabetes, and what can community partners or healthcare providers do to assist with that?
So there are two things. First, we want to prevent people from getting type 2 diabetes as much as possible.
Okay.
So the things we think help lead to type 2 diabetes are a diet that isn't as nutritious as it should be. So more sugar, less vegetables than you should have. And so the healthier you eat for more of your life, the less likely you are to ever get diabetes, but if you do, you'll get it at a much later age. So we're looking for people to eat that kind of healthy fruit and vegetable, whole food kind of diet, and if they can do that, it tends to prevent diabetes, or at least make it happen later and less intensely. We also want folks to be able to manage their diabetes well if they get it. And so that includes a lot of things. If you're changing the way you eat, you're changing your exercise, you're doing lots of more medical appointments, those things all take resources. So it is expensive and inconvenient, maybe, to have to get different kinds of food than you're used to eating. People develop what they like to eat over a long period of time, and now suddenly some of the things that you eat are maybe not the best and you should eat different things. That is a big deal for somebody to try to change. There's lots of medical appointments that need to happen if you're going to manage a chronic disease well. You need to really get a relationship with a medical provider who understands you, and that's because the disease changes over time. Either your medication is going to work, which means you have to have visit after visit to really try to find the right medication for you, or you're going to make lifestyle changes and you're going to need less medication. All of that means somebody's got to watch it over time. They've got to see how you're doing now, see you again in 3 months. And if you have problems with transportation or childcare or getting time off work or all those things that make it hard to get to the doctor, if those are already a problem, having a chronic disease means that they're more of a problem. And those are the people who don't get their diabetes managed well.